cording can be invisible, and so sometimes when people raise their arm, it is very hard to see the severity of the cording. And so in this case, you can just see the raised area in the armpit where the cording is. In this case, the woman was 10 days after surgery, and there was a significant tightness of pec major, and what she complained about was pain into the arm. That was the thing that stopped her from lifting her arm up. And again, difficult to see the cording, quite hard to detect. The arrow there, and I'm just going to show you, is that the cording is here, which is underneath the tight pec major. When we do the specific testing, then it is much easier to see the cording. And so in this instance, with this testing method that we'll be going through, you can then see where the impairment is, where the cording is. Positioning of the arm is important to test cording. So the photo on the left is impossible to see it, but the photo on the right, we can clearly see where the cording is. The second component of those tests are, so that was just range of movement, is to then detect the cording. And so in this instance, this lady has reasonable shoulder flexion and then abduction, but we still can't see the cording. So the next component of this testing method is to be able to put your hands on the body and use skin and fascia stretch. And when we do that, then the cording becomes both visible and palpable. So we need the arm to be in the position. We've ruled out muscle bracing. We've used the gentle contract and relax. Next is being able to palpate the cording, and more importantly, to feel where it is adhered or inserts into the fascia or the structures on the chest. And using this test, it is a very good way of the person being able to feel these restrictions. And so I use the test at the beginning of the session and then after treatment, and it is a delight to see people's eyes kind of pop when they do the retest, because they can tell straight away that they've made gains.